So my name's Elisabeth, and we are going to be talking about something that is a unique perspective to me, the cost-benefit analysis of what we're doing here as cannabis medicine. And I've been a nurse for a long time, but I got an MBA in healthcare administration. So from 86 to 96, I was in hospitals, mainly psychiatry, 8 years of locked units. And then I got an MBA in 96, never thought I'd be a nurse again. But it gives me a unique perspective to come back after 20 years. My last real job, I was the regional sales manager for Anthem Blue Cross for the County of San Diego. So I ran employee benefit programs. And with that lens, I'm going to be talking a little bit about that sort of a thing that we're not really considering here that we should. So when it comes to healthcare in America, what are we paying for? We're paying a lot. $3.3 trillion in the last national health expenditures in 2017, but we're placing 42nd in outcomes. 50% of all American adults 18 and over are sick with at least one chronic condition. And so spending 18 to 19% of our GDP is a lot, right? And we're taking dollars from other places that we should be using to supplement other things. And so what happens? We get 5 minutes when we're in the doctor's office, right? 76% of all of those office visits end with a script, right? So you come and you get polypharmacy, and then you get the side effects from that. And so we're basically paying for what I call encounters, right? When you go have an interface with the doctor and you leave and you're still sick. So what should we pay for? What should we be paying for? Well, how about the things that move us towards wholeness and wellness and well-being, the things that people don't talk about? So how can we get people to get a work-life balance, get some whole food nutrition, mindful eating, mindfulness period, prayer, meditation, movement, being able to play with their kids, being able to take that hike that we all talk about, so nature, and finding joy, because that's what our whole purpose is as a human, is to find joy. So when it comes to costs and benefits, coming from a healthcare perspective, I'm going to just kind of blow your mind. I don't think you know how much it's costing, but really everything goes down to what the insurance card is in your wallet, right? Think about that. So this is my old life. Costs and benefits, right? So you've got your premiums, your deductibles, your out-of-pocket max, and then the true out-of-pocket max. So if you were to take your premium paid each year and you're on a gold plan, which is probably the best if you are a little bit sick and you need care. You're probably going to want a gold. If you're not too sick, a silver is a better option. But then you have your deductible and you're out of pocket. So you're paying almost 20 grand. And on the bronze plan, if you get sick, it's even worse. So no charge for diabetes education, but absolutely no coverage for nutritional education. Isn't that a travesty, right? So we could do better. We can do better to help people avoid diabetes. Okay, so we're here to talk about cannabis as medicine, and it is. 4 years ago, when I left Anthem, it was because I got in a bike accident. I was able to not take the oxycodone. I got ligament reconstruction on my shoulder with just a 1-to-1 in several different ways. And so my whole thing is, let's prove that cannabis as medicine deserves a place on that spreadsheet that I showed you a minute ago, and get parity for the plan. So how do we do that? We talked about data. We talked about having some evidence-based outcomes and tracking this. So this is just an average patient of mine, Joan, 63 years old. She retired a couple of years ago, had some injuries, had a car accident. She's got some neuropathy. She was also depressed, taking just your traditional NSAIDs, muscle relaxants, gabapentin, who's not on that. A couple of Oxy and Zofran and Ducalax for that. Well, how about a cannabis makeover? So we talked about, she wanted to take some hemp-based CBD to start, so 15 milligrams of a CBD capsule twice a day. Got her some anti-inflammatory effects, some 5-HT stimulation. She's a little less depressed, a little more serotonin. Got her to treat the pain with a 1-to-1, able to wean down off of that Oxy. She was not taking it in about 2 weeks. And then the other thing is I talked to her about her nutrition. Got her on an anti-inflammatory diet, got her to be taking a whole lot more interaction with other people. Before you know it, she went to her church group, started to serve on a food ministry, And then she started to do some restorative yoga after I got her walking initially. So I really blend in a functional medicine approach with what I do because you need to. Cannabinoids are just facilitators to do this, to be able to have that. So with Restored Appetite, she was able to, now she was doing the food ministry, and then before you know it, she's going out to a monthly meeting where they're doing movies, right? So now she's active and engaged. She's not alone, sitting there, woe is me. But what's the problem, right? Costs. So when I talk about the costs and the benefits, right? When we get all those benefits, the intangibles, who's tracking the cost? And when we go to the dispensaries, is anybody even talking to them about how affordable this is for their clients? Because we might have safe legal access, but until we have insurance coverage, the affordability issue is the largest barrier to care and getting people to be able to cover this. Now, of course, they can grow their own, but a lot of my patients never would. And so, you know, when you look at $100 a month versus almost 300, it becomes unaffordable. So I have a dream. Anybody have this dream? I have a dream. This is my dream. And you know what? In Canada, they're doing this. They've built in a rider. Because they have federal legalization for medical, they've built in a rider. They get up to $5,000 benefits per year to use on certain cannabinoid medicines that you get through the pharmacy. Isn't that cool? And so, you know, and it's funny because 3 months from now, in June, I will be addressing this same room with the National Association of Health Underwriters. So all the people that bring the insurance coverage, I'm going to be telling them about this. They're going to get this slide. And so why should insurance carriers want to cover this? Why should they? Because this really does move the needle on patient care. We know, we all see it. Anybody that's had a few hundred patients, we know that this really makes a difference. If people eat, sleep, relax, forget, protect, we move the needle from the distress column over to the well column. Over time, it's cumulative dosing. This is not a panacea. It's not. We need acute care, absolutely, but this is for the chronic conditions that are refractory. And also, we're going to tell them about how we're going to cut down on the scripts. We're going to save millions of dollars in lives and billions of dollars. And you know, when 25% less people overdose in the states with legal access, then that's something that they're going to start listening to. So, in summary, you know, there's value in outcomes. And for me, it's all about the outcomes. It's not about encounters. It's about health and wholeness for all. And when I have somebody tell me I'm just not hurting anymore and I just feel better, when I have somebody say, you know, the monkey mind is shut off, I can relax, I'm more present, I like myself better, I'm more at peace. I hear this all the time, and then I talk to them about spirituality. It's important. And so people become more open, more joyous, and that's just amazing. So, you know, let's change this paradigm together because America can't afford not to.